So welcome everyone. I see our attendees are getting populated at the moment. I hope everyone had a fantastic long weekend, and we love that we're coming back and really hitting the ground running again, because as you know, our goal of these series is really to challenge our thinking. I hope we've done that as we've been progressing. And if folks have any questions or have any feedback, you can always feel free to contact me and let me know. But we're really excited for today's conversation with John A. Powell, and we promise to be, hopefully it will be just as stimulating as some of our others. Just wanted to let you all know that this is being recorded for internal purposes. We'll share them if folks couldn't make this. We'll happily share it on our internal website. Just make sure your calendars are marked for we have a number of 3 director series coming up. One with Dr. Lisa Lazzoni from the Harvard Medical School. And then on March 8th, that one is on February 28th from 11:30 to 12:30. Our second one is on March 8th, and this is going to be a really great discussion. Actually, Boyce is going to be our interviewer with Emily Halubowicz at the American Heart Association, having a candid conversation about how we communicate with outside stakeholders, especially on the Hill. And then our last one that is scheduled is March 17th with Dr. Christine Sinsky from the American Medical Association. So please keep your calendars marked. I think everyone has a calendar invite, and we hope you can join us for that. In any case, I won't take up more of this time because I know it's going to be a really dynamic conversation. So with that, I will turn it over to David to kick us off.
Thanks, Jamie. And thank you to everybody at AHRQ for joining. This is a real treat for me. I invited Professor Powell to join us in December, and he picked of all days today to join us. And John, I don't think you know, but today I moved from being the AHRQ acting director to the AHRQ deputy director, as we are getting a new director as we speak. So it's actually a really exciting time for the agency, but this conversation needed to happen. Folks know that I've been asking our team to build an equity framework, a perspective of how we think ongoingly about our work inside the agency to build a just workplace, how we help the health services research community and health delivery organizations themselves become just organizations, and how we use our research and our data to change healthcare for the American public. And earlier this fall, as I was musing about this, a good colleague at AHRQ said, you need to read John A. Powell's work. And so I did. And I took out one of your workbooks on Targeted Universalism and said, this is the person I need to have come speak with us. So I'm really excited to have you here. As I always introduce these things, this is a chance for you to make me uncomfortable, make all of us uncomfortable, as a chance to help us grow. So AHRQ folks, John A. Powell is an internationally recognized expert in the areas of civil rights, civil liberties, structural racism, housing poverty, and democracy. Professor Powell is the director of the Othering and Belonging Institute at the University of California, Berkeley, a research institute that brings together scholars, community advocates, communicators, and policymakers to both identify and eliminate the barriers to an inclusive, just, and sustainable society, and to create transformative change towards a more equitable world. John holds the Robert D. Haas Chancellor's Chair in Equity and Inclusion and is a professor of law, African American Studies, and Ethnic Studies at UC Berkeley. Previously, he was the executive director of the Kirwan Institute for the Study of Race and Ethnicity at The Ohio State University, where he also held the Gregory H. Williams Chair in Civil Rights and Civil Liberties at the Moritz College of Law. He founded and directed the Institute of Race and Poverty at the University of Minnesota as well. He has served as the Director of Legal Services in Miami, Florida, and was the National Legal Director of the American Civil Liberties Union, the ACLU, where he was instrumental in developing educational adequacy theory. John is well known for his work developing the framework called a Targeted Universalism, and also his writings on othering and belonging and their effect on equity-based interventions. Professor Powell has taught at the numerous law schools, including Harvard and Columbia universities as well. Professor Powell, welcome to AHRQ.
It is good to be with you.
So I'd love to start the discussion by asking why you chose the name Othering and Belonging for your institute. You and your team chose it for the institute that you now lead. Othering is a word that I sometimes think of as a very negative thing. It distances us from people, and most people don't put negative words in the titles of their organizations. What's the thought?
So essentially, we went through a process in changing the name. It used to be the Haas Institute for a Fair and Inclusive Society. And then at some point, we have conferences, do a lot of work. We have an Othering and Belonging conference. The institute is fairly large for institutes. We have about 120 faculty and about 70 students. I know probably compared to your agency, that's quite small, but for universities, good size. And the faculty is distributed across 7 different clusters, dealing with marginality from race to gender to disability to religion to sexual orientation. And then, so there are all these different themes. And my sense was, what do they have in common? What does LGBTQ have in common with disability? And it occurred to me that actually what all of them were grappling with was being marginalized and being other. And they were trying to engage in a process, both research and practice, that would support belonging. But then we actually tested it. We went out in the field, we were a bunch of researchers, so we went out in the field to see what people thought of it. And there was a debate as to whether we should be a Belonging Institute or the Othering and Belonging Institute, to your point. And it's interesting, most of the people in the academy wanted to be the Belonging Institute. Most of the people in the field, in the community, and we work closely with the community, wanted to be the Othering and Belonging Institute. And what brings them to this question, brings them to the issue, is the sense of being other. And they felt like just to say belonging wouldn't create the sharp tension and dynamism that othering actually brings. And so going through a protracted process of almost a year, we decided that they were right. And when you look at the polarization and issues of fragmentation and the expression of othering is happening all the time. In a sense, almost as much, if not more, than the expression of belonging, although the two are deeply interrelated.
It's a great lesson in the importance of asking the people you're trying to work with or that you're studying and that are doing the day-to-day work, what they think and how it changes. It's a good lesson for all of us at AHRQ as well. In our pre-conference, we talked a little, I was able to share how AHRQ focuses on health services research, generating new knowledge, helping health systems and health professionals use that knowledge through training tools, resources. So leading practice improvement work in safety and quality, equity, and in value. And then we also have a data component. And we not only collect data, we analyze data and try to make it available for policymakers to make informed decisions. And when I was reading the word othering, I was struck by a quote that I think was attributed to you on the website, that othering, that process, well, I actually now can't remember the quote, so maybe you're going to have to help me, but that we do that in healthcare data when we have those categories A, B, C, D, other. And that process of just what does it mean to people to see themselves in that other box.
Right. It's actually interesting. I mean, I think to me, it's like looking for a yellow Volkswagen. Once you start looking for it, it's like, God, I didn't know there were so many yellow Volkswagens. They're everywhere. So the process of othering, which happens at multiple levels, whether it's health, whether it's schools, whether it's in employment context, whether it's how we pick neighborhoods, how neighborhoods pick us, whether it's voting, and in some ways, a lot of the work goes back to Maslow's insight, where he saw belonging as the third most important need for us to be fully human. But now, when you look at what everyone's thinking about this, like belonging to a community, belonging at your workplace, belonging to your country, and so what we find is that it's incredibly important in terms of health. Maslow basically says you can't be a healthy person unless you belong. And the opposite of belonging is othering. And our whole country, if you will, has struggled with this. It's like, who belongs? Who constitute the we and we the people in our Constitution? And it's been a fight about that. But it's not just a political fight. It has very serious consequences in terms of how we feel. So an example would be when you give a standardized test, and what people are finding is that when you have the students check their racial and ethnic identity before they take a standardized test, for Black and Latino students, their performance actually goes down. They check the box and they are aware, and this is Claude Steele's work, Stereotype Threat. They're aware that, they know they're Black and Latino, but just checking the box, having to affirm that, actually depress their outcomes because they're aware that in society, those groups are not supposed to perform well on standardized tests. And so we've gotten some of the test takers to actually collect the information after the test. It has a huge impact in terms of how they perform. And so, yes, asking someone to, either designating someone or asking someone to designate themselves as other is very unhealthy.
Do you have any recommendations for, as a large federal data collector? So one point, and we actually preach this a lot, my team has taught me this, that putting the demographic questions at the end creates higher quality data, more reflective of who the people are, which I think you then said Steele's work. So we'll have to go and use that as an example of why this is so important. But how do we address the issue of small sample sizes or small sets where we don't want to invade somebody's privacy that we promise to protect by saying you're the one Asian American woman over 65 in your county, and so now everybody knows that must be you. And we tend to then just say, well, we'll call it other.
Right.
And that's not a good answer either. Do you have recommendations?
Well, like a lot of things, and I'm sure this will be true throughout our conversation today, I really respect what you're doing, and I think it's critical for the country and for the people in the country. And it's also complicated, so that to seriously engage some of that question, but others as well, I think would take a little more time. But I will start by saying what you're saying about us coming up with the name othering and belonging is to have people engage themselves. In other words, have people participate, including those people who quote unquote are other, in thinking about data sets, questions, stories you tell around them. And the thing about data, which is interesting, is that it's as important as it is, its importance become even more poignant by the stories, by the wrappings, the bow we tie around it. So what are the stories you tell about these categories? Do people get to tell their own story? I remember being a kid, there was times when I would object to when people say, what race? And sometimes literally, David, and I'm not one who embraced the idea of colorblindness, but sometimes I would put human. They say, what race? I put human because I felt like people were pushing me in a category that I didn't choose and that had a lot of negative associations with it. And so I think part of it is how do you actually come to some meeting of the mind so people feel like they have some agency, that they are being seen. I mean, part of being belonging is agency, that you are seen. So if there's space to do some of that, I would do some experimentation around that.
Okay, and I want the longer conversations too, but that is a great start to I'm sorry, a very difficult question. One of the things I know we can go in many different directions. I'd like to give my guests the chance to say, okay, so you're now speaking to a 300-person agency with a $400 million budget. We can't change the world, but we can have an effect on the country. What are the 2 or 3 things that you want the team here at AHRQ to take away in case they have to drop off the call, or even to give them a scaffolding of where we're going to go when we talk about targeted universalism? Are there some key?
Yeah, there are. I mean, it's interesting, and part of it is just like, where are we in the process of creating a healthy and inclusive and sustainable country? And we'll have different assessments as to where we are and What are we trending? Are we trending in the right direction, the wrong direction? Sometimes it's hard to know. But I think the need to create a space where everyone belongs and every group belongs is absolutely critical to both the health of our country, the health of individuals. And I think you guys play an important role in that. And so how do you do that? And I think there are things we do that unwittingly actually create polarization and breaking, and the things we can do consciously to create bridging and belonging. So I would almost run everything through that metric. Is this promoting bridging and belonging, or is this promoting unwittingly breaking and polarization? And then the other thing I would say is really creating a space to, I'm sure you do this already, but really listen to different groups, hear what they have to say. Not saying you're agreeing with them, but just really listen and listen to not just what they say, but what's under what they say. And I was talking to a fairly close friend a few days ago, and he was repeating himself over and over again. And literally, David, I said, okay, I'm done with this conversation because we're just going over the same thing over and over again. But then he would pull me, he want to stay in the conversation. We're on the conversation for like an hour and a half. And I felt very frustrated. It's like, why? This should have been a 3-minute conversation. It's an hour and a half. And then as we're getting off the phone, he says, thank you for staying on the phone with me for the entire time. And I realized what was happening was not the words. There was something at an emotional, psychological space that he was engaging around, and I was missing it. Because I was engaging with the words. The words didn't make sense with all the feelings behind it. So I guess I'm just saying, being able to really listen deeply to different communities. And one of the ways you listen, which is to me fascinating, is data. So people talk about structures and how do we know what structures are doing, and it's data. We see patterns and structures, and those patterns are really like telling us to look more deeply at what's going on. So when we see a pattern where one group is always not doing well, or one group is feeling isolated, or one group is feeling or having bad health outcomes, there are all kinds of things you can look at, but the patterns themselves is communicating. So those two things, I was saying, that sort of the building consciously a space where everyone belongs, listening not just to the words, but what's under the words, and using data to sort of identify patterns.
That is a perfect segue into what I had said. I introduced you as an expert in, and what inspired me so much is your concept of targeted universalism, because I think that where data goes, and my own experience is that in our disparities work, which is what the agency is famous for, and I think has a lot to be proud of in it, that led us to start with the data and never get to an equity framework. Mm-hmm. And you suggested a different way, and which I think also ties to your idea of how do we make sure everyone is brought into the movement, to whatever we're trying to improve, which is that universalism thing. So I'd love to give you the opportunity, rather, my team, some of the people have heard me try to paraphrase it, but I'd love you to explain what you see as the power of the framework of targeted universalism to change our discussion on from equity to equity 2.0.
It's a great question, and obviously one I love. I sometimes, because I have this wonky phrase, you start off with othering and belonging, that's pretty wonky to begin with, but then targeted universalism, what the hell does that mean? A lot of people stumble over it, and it's understandable, although once you break it down, I think it makes a lot of sense. And in breaking it down, I remind people that I'm credited with helping start the equity movement in the United States in the early 90s, but also more recently with the targeted universalism approach. And I appreciate the acknowledgement. But the person who really started the targeted universalism movement was Aristotle. Aristotle, where our concept of equality largely comes from Aristotle. And Aristotle talked about equality. He said equality and fairness. He says equality and fairness requires when people are situated the same, you treat them the same. Okay. But equality and fairness also requires when people are situated differently, you treat them differently. That's targeted universalism, saying when people are situated differently, you treat them differently. And it's fairness. And sometimes we get confused about that. It's like, I treat everybody the same. Well, that only makes sense if everyone's situated the same. To treat a person who is sighted and a person who is blind the same makes no sense. And yet what we've done in the West largely is grab onto the first part of Aristotle's insight and assume they were all situated the same, and we're not. So what targeted universalism does, and as opposed to equity, two things. Equity in practice focus almost entirely on disparities without wrapping that bow around it, without wrapping a really bridging story. The bow should be a bridging story. The bow should be something that everybody's inside that package. What equity actually does in practice is basically pick winners and losers in terms of scarce resources. It says that some groups have too much, some groups have too little, and we need to focus on some group, and even more narrowly, we need to focus on the group that's at the bottom. Well, think about that. If someone says only one group is going to get something, it's the group that's at the bottom, then first of all, almost every group is going to compete to be at the bottom. Is it Native Americans? Is it African Americans? Is it Latinos? Is it rural whites? Who's worse off? So then that's that kind of priming is not even healthy. It's like, I want to tell you how bad I'm doing, right? And hoping maybe I'll get something out of it. But it also ignores, once you pick that winner, that apparent winner, every other group is largely left off. So you have groups competing for scarce resources. Well, that creates all kinds of animosity between groups. And even to go one step further, the group that we think of as the favorite group, and it may or may not be the favorite group, is seen as illegitimate in some way. So equity then becomes oftentimes in our discourse, it's like white people versus everybody else. That's the first cut. And then within that everybody else, we really need one group that's doing so bad that that's where we're going to focus all of our resources. And then you end up having breaks, tension between all the other groups. And the political salience of that approach is very suspect because all the groups who weren't chosen starts picking at it, starts saying, this is not fair, this is not right, this is not, and I'm not saying, at times you don't have to pick a group and all that, but I'm saying it creates a framework where people are going to be fighting each other. So what Targeted Universalism says is that instead of picking as our benchmark what the favorite group has, we pick it independently of any group. And so the universal is, what should everybody have? So we can pick anything, like we say education. If we say 75% of white students graduate from high school. So is that the goal? We want to get every group to that 75%, or we want to get every group as close to 100% as possible. Healthcare. Before the Affordable Care Act, again, about 70% of whites had health insurance. So is the goal to get everybody to 70%? Or worse, is it just to close the disparity? Because we can close the disparity by reducing what the favorite group has. Not everybody's screwed, right? But screwed equally. And so what Targeted Universalism says is, no, we don't assume what the favorite group has, and they may not even be favorite, but what they have is the appropriate goal. We state what everybody should have. That's the universal. The goal, universal. Everybody should have this. Every group should have this. Then you say, how are groups situated in relationship to that goal, structure, and culture? And you develop targeted strategies to get each group to that universal. And you're trying to get every group, not just the least favorite group, but the groups in the middle, and every group to that universal. But it will be a different intervention based on where they are and the culture. There's some nuance that I just say. One would be, how do you pick the universal? And we say groups collectively pick the universal. I don't pick a universal, or the agency doesn't pick the universal. You actually make sure it has some resonance in all the various communities. So that's targeted universalism. Universal goal, targeted strategies based on our situatedness and relationship to those universal goals and our culture. And in doing so, you actually bring people together, right? So it's not only practice, but it's also then people see themselves as part of this effort, and you're not picking winners and losers.
So when I've read this, because I want my team to hear this and I make sure I get it right. So that we start as a large community, everyone defining what we think is what the universal goal should be. We want children with asthma to be able to thrive and manage and their families manage their conditions and participate in school and activities. And that's forever. And 95% of children with asthma should not miss any days of school or some goal like that. And then I think, though, what people at AHRQ are going to be able to do is say, then we use the data. We don't start with the data. We use the data to understand what different segments of the community, how they're doing in relation to that goal. And then what I think it's the hard work, but you've said it, is then you have to look at, well, what would it take? What are strategies to help each of those groups reach the universal goal?
That's exactly right. And Targeted Universalism is a practice, a platform for practice, but it's also a platform for communication. So you communicate that everyone counts. And so if you're saying you want to get everyone there, it's both collecting data, but it also tells you how to collect data, right? Because how do you know where people are in relationship to that universal? You have to disaggregate the data. You have to look at the different groups. So you think about at the beginning of COVID, we didn't have disaggregated data. And everyone, in fact, people were saying this is an equal opportunity virus. It's not. It's distributed very unevenly across the population. We were one of the first groups that worked with Michigan to get them to disaggregate the data. Because first people just saying, we don't have disaggregated data. And people thought the data would be relatively evenly distributed. It's not even close. So even how you collect the data to see how groups are situated becomes part of the thing informed by targeted universalism.
Interesting. It seems like that by framing this and what you've done, and you described it as that wrapper, it makes work in the equity space not a us versus them. But you get to say this is for all of us at the beginning and get everybody involved. Does that also then mean that within the targeted frameworks, you can't just do one?
That's right.
But you don't have to distribute it exactly evenly either. Like that's how you.
And this pushback, and I'll just name it. Maybe among your 300 plus people at your agency, someone will feel this. People tend to fall on one side or the other of targeted universalism. So people who are identified as either being conservative or moderate, the universal, we literally want. They misunderstand the universal. It's like treat everybody the same. That's what I believe. We don't see race. We don't see sexual orientation. Everybody's the same. That's not what we're saying. We're saying the goal is universal, and everyone's not the same in relationship to their goal. But then people who are sometimes appropriately very active and agitated say, we just need to pick one group. Whether it's based on race or whether it's based on income, it's like, we're going to pick one group. And there's some concern that targeted universalism may dilute our ability to focus on, for example, African Americans. In some ways, it's just the opposite. Because when we think about any of these things, but certainly race, we say race is socially constructed. But we then don't do the actual work to figure out how is it constructed. And what targeted universalism is saying is that you got to look at the situatedness of the group. That's where the work is. And so you're looking at the situatedness of different groups, and that's important. You're not picking groups because they're Black or because they're Latino or because they're white. You're picking them because of where they are in relationship to universal and how they're situated in society. And yes, that's racially coded, correlated, But a more direct way is to look at the situatedness directly.
So you've given stories that explain why universal solutions, as opposed to universal goals, don't always work. Could you share with the team? Because I think we get in the federal government, people are like, well, can you give us the solution that is going to help the most people? And we often have to explain why that's not. I know in your work you've seen that.
Well, when you think about it, David, it's obvious, right? It's like if I have 4 kids and one kid has serious flu or something, and the other kid has a cough, and the other 2 kids are fine. So I'm going to get some medicine divided equally between the 4 kids. The kids who are fine, it's like they're going to be fine. The kid who has a serious flu is now probably taking 1/4 of the medicine she needs to get better. But I treated them all the same. They all got exactly the same. Another example I use is that structures and interventions, structures are doing something. We design them to actually produce something. They're not neutral. We don't design a structure to be neutral. We don't design a house to be neutral. We design it to actually protect us from the elements, to provide shelter, it's designed to do something. But it's normalized based upon certain groups, oftentimes unconsciously. So to give you 2 examples. Think about flying. Back in the old days when we flew around the country a lot, we get on a plane and check our luggage. Well, luggage racks on an airplane are overhead. There's a certain group in our society that's shorter than other groups. And of course, I'm referring to women. As a group, women are shorter than men. As a group, women have less upper body strength than men. And as a group, women carry more luggage than men. So you can literally, the next time you're on a plane, you'll see women struggling to get this thing up over their head into this luggage rack. So this rack is actually creating difficulty for the woman and is serving the man quite well. So what do women do for this structural problem? Women disproportionately check their luggage, which means they have to be at the airport an extra 45 minutes early. They leave the airport 45 minutes later, and frequently their luggage get lost. The individual solution doesn't take care of the structural problem. Another example would be build an escalator. An escalator is not neutral, it's designed to do something, but we normalize it based on someone who's ambulatory. So the guy comes along in a wheelchair, what's the escalator going to do for him? It doesn't work, but we're treating everybody the same. Everybody has the same opportunity to get on the escalator. Now, if we focus on the guy in the wheelchair, there's sometimes a mistake. We think he's the issue. We got to fix him. So maybe we'll give him crutches and help him, but he's not the problem. We've designed a system with someone else in mind. And when he comes along, it looks like, okay, he's needing special favors? No, it's not special favors. We've designed him out of the function of the escalator. And so that's the other things that oftentimes we think when we see groups who are outliers, we think it's the group that needs to be fixed instead of the structure that actually needs to be addressed.
Can you take that into healthcare a little more directly? Because a goal, a universal goal, could have been create health insurance for everybody. You said that, right? The ACA, bring everybody's insurance, which sounds like a reasonable goal and a solution. But you've argued before that's both a problem. It's not the right goal because having insurance is what we want for people, but it's also not necessarily addressing the structural problems, is it?
That's right. And we have concrete examples of that. I mean, when Massachusetts adopted this version of the Affordable Care Act and did it first before the federal government did. And what it did is it promoted insurance to virtually the entire adult population of Massachusetts. And the argument was that by doing so, because Blacks and Latinos were less likely to have insurance, they would benefit more from this. One of the things when I talked about structures and looking at patterns, so look and see what's actually happening, not what you intend to happen. And so the intent was people have insurance and therefore people will have better medical outcomes. What happened in Massachusetts was as the number of people who had insurance increased the demand for healthcare workers, and healthcare workers were pulled out of Black and Latino communities. So ended up having a piece of paper, but no providers. The insurance was a ticket to a passage to get to providers, but once you were competing with the larger population, you still couldn't compete. It actually made you worse off in some cases, not better off. So that insurance itself was never the goal. That was just a passage to the goal. And so they had to correct that. And the Affordable Care Act actually took that into account. It had to be very deliberate. And we see that a lot. I live in the Bay Area. When they start looking at these metrics for is the infection rate going down? And they would say, yes, it's going down in the aggregate, but it's not going down in the Black and Latino community. In fact, it might be going up. And this was just, to me, it just had all kinds of implications. So one intervention, everybody should wash their hands 5 or 6 times a day. Okay? That sounds like a reasonable, universal intervention for COVID, right? And then they say, wait a minute, 35% of people living on the reservation don't have access to water, to clean water. So that strategy is simply not available. Or they say, even in the controversy about the vaccine, which is interesting, your immune system is compromised. So we want everybody to get a vaccine, especially if you're immunity compromised, because you're more susceptible, except now you're also susceptible to having a negative reaction to the vaccine. So that universal intervention, we're going to get everybody a shot, especially those who are immune compromised, except the immune compromised are the very people, in some instances, who can't get a shot. And the goal was not really to get people a shot. The goal was to get people immunity and protection from this virus. And how you do that is not going to be the same for all populations. And it took us a while to sort of begin, and we haven't completely figured it out yet, but to begin to figure it out. And then location, where do you go? And then, of course, the real thing is the trust level. So it's like, I mean, obviously it's a big issue in terms of some people, I don't trust, and I actually worked a little bit with the WHO, and they were saying, how do we make sure this gets into the Black community? How do we, I said, when you show up there, in many cases you are showing up because you don't live there, and you say, I'm from, I'm from Washington, and I have a needle, I want to give you a shot. It's like, oh, no, thanks. I've seen this picture before. And people might not understand that there's different trust levels because of people situated with government, because of people's different history, because of who's showing up. Frankly, if a white person I've never seen comes to my neighborhood, it's like, why are you here? Tell me again. I'm here to give you some medicine. You can trust me. It's like, I don't even know you. So there are all these things.
So I have to take a big deep breath because you're I think the word my wife would use is problematizing this, and that's important. And so what I'm hearing for AHRQ is universal goals created with communities, use data to understand where people are in the place, look at the structures to explain, and look for the patterns of why, and try and go back to those communities to talk about what may be doing. A huge dose of humility that this is complex, and that if we think simple solutions are going to work, we're often wrong. I loved the idea that you said you have to evaluate even when you think you got it right. did it do, even if you had the right goal, are you moving, did your intervention move you in the direction you wanted? But also that it can be done, that that it can feel like we're never going to change this. But if we start using these techniques, building trust, building belonging, inviting people in, listening with humility, we can actually devise interventions that actually begin to move people, communities, and therefore everyone to our universal goals. Is that?
That's exactly right. We've done that. And I know we have time constraints, but I'll just give one or two quick examples. We work closely with Native American community on the ACH up in Oregon and Washington. And, and they've adopted a framework of targeted universalism. And we talked about the data. And the first reaction, David, is like, no, we don't want anyone collecting data on us. So even the data issue was an issue, right? I mean, it's like, it wasn't an issue in some communities. It's like, yeah, you want to fill out a form, I fill it out. But you go to Native American community in Washington, Oregon, it's like, people have collected data on us, not for our purposes. We don't want the government to have any more data on us. And so how are you going to, and so it took literally a year to convince, and then to say, okay, what if you collected the data? What if the data, what if you control the data? What if you created the privacy things in place? And then what data do you want to collect? Now, obviously you want some consistent data so you can make some comparisons, but also that's going to be data that communities want that other people are not that interested in. So even the data collection had to involve, data collection wasn't universal, right? It had to be, in a sense, sensitive to how people were situated in relationship to things, and to take that seriously, and not just to say, okay, you're not in the program because you don't want us to collect the data, and we can't do anything without the data.
Yeah, can't we? Those problems deserve more answers, not walking away. I have so many more, and I have a list here, but I'd love to turn it over to the team. So, Jamie, how are we doing? Are there?
Yeah, so we have a couple questions actually. I'll pick this one first only because it's relative. It relates to what we were just discussing. But the question is since race is a social and not biological biologic measure, should we continue to collect race data? If we do so, are we perpetuating the notion that skin color is important? And if that's true, like should we also be collecting eye color, height, etc.?
So it's a great question. And like many of these questions, I'm sure it's actually more complicated. We don't just do things. So there's close to consensus that race is not a biological phenomenon. There's still a few people who object, but it is biologically measured. So by that I mean, I was doing there's a friend of mine who's head of the Brain Institute out here at UCSF, Bruce Miller, and we were doing something together. And he said, I study the brain. I don't study race. And it's like the brain's an organ. It's not, black or white or Latino. And I was on the panel with him, and I'm not a brain scientist. And I read Bruce stuff, and he's brilliant. And I said, so then someone turned to me and said, so what do you think about that, Professor Powell? I said, well, it's actually wrong. And there was an audible gasp in the room. It's like, you're calling Dr. Miller wrong in a field that he's basically almost created. And I said, the brain interacts with the environment. And because our environments are racialized, the growth and production of the brain for people in one environment actually be different from people in a different environment. So the brain, there is such a thing as the Black brain, not because of biologically born with it, but because of the environment actually produce it. The whole idea of epigenetics. And then people turned to Dr. Miller and they said, what do you say to that, Dr. Miller? He said, he's right. So it's not so simple. So race is actually, the way it functions, it creates part of our physical structures actually get imprinted on the body. And so I would say you have to be more thorough. And sometimes it starts at a very early age. I have other friends out here who work on telomeres, which are, as you know, which allows cells to absorb nutrients. And they're different for racially. but they're not different racially because it's inherent. It's because people have an experience, and experience getting registered in the body. So I say, yes, still collect it. You want more information. And when you can break that association, then you can stop collecting the data. But that association is there right now.
So we collect race and gender and other things because the patterns are still there. We're not doing it to treat it. We're doing it to understand where the disparities are and then create targeted solutions. That we have to do the deep work, as you just said, of understanding the structures, not the people. Right? Okay. So I saw a comment very quickly, and I think it must have been either me, or probably me, that misspoke, but we use the word universalism. You are not trying to use the Rousseau or the European philosopher of universal law, correct?
No.
Could you explain the difference between what you mean by universalism?
There's a whole series of things in terms of natural law and Immanuel Kant. I don't know if that's the person talking about. Where it's like there are just some things. It's extreme. You would say, I can stand in for every person because every person has the same whatever. And reason in a Kantian way, I won't go too far down this rabbit hole, but John Rawls wrote a book called The Theory of Justice, and he talked about if you could stand behind the veil of ignorance, you can make decisions, and essentially we make all the same decisions, right? So that in a sense we can all stand in this universal process. That's been heavily critiqued. So I'm talking about people coming together and making agreements, right? And it's not abstract. It's not simply analytical. It's like, I don't know. I might say, we're all some version of me, right? So I'm a vegetarian. So I assume you're a vegetarian too, David. Maybe you're not. But so it requires coming together, not assuming that we all make agreements. That I can make an agreement and just assign it to you as a good person. I got to really talk to you. I got to really engage with you. And so we make agreements for that purpose. And that's part of belonging. Belonging is co-creation. The thing you're joining is not already there. You co-create the thing you're joining. So that's why, in terms of doing the research, in terms of collecting the data, in terms of the application, it's like as much involvement as possible with various communities, and especially with communities that are marginalized, because almost by definition, being marginalized means their voice is not
part of the community. I think I interpret or I hear some of what you're saying, and I love the use of the concept of co-creation. It's that we create community. And so the universal goal is the community co-created goal that we're, as a community, we all want to move towards. And if we marginalize and don't include everybody in that discussion, then it's not actually universal. It's just serving our narrow purpose. Jamie, sorry.
Yeah, no. So along those lines, another question that we received is how do you address when the best case scenario is not really good enough for anyone? Quality and safety of care. So you need to set higher standards and help everyone achieve them.
I think if I listen to the question, I think there must be a fairly specific circumstance behind your question.
John, I actually think this is so set up for you. I think this is the example of if nobody's getting the right, has been able to achieve the thing that everybody believes, is that a problem? Mm-hmm. Setting the bar higher than any group currently has.
Well, I say that's not a problem necessarily. In fact, some people, when they hear belonging, the othering and belongingness, it's like, well, we don't have that. It's aspirational. It orients our work. So when you say we want a cancer-free society, you say, but we don't have one. Yeah, but we want one. It orients our work. And it's also something we can measure against. Are we getting closer there? We don't just what we already have. We're moving forward, and if we move forward collectively, I mean, think about HIV. When HIV and AIDS was first researched, the early research on HIV, as I understand it, and they were doing all of these tests for cure, and they were one failure after another. And then apparently some of the researchers noticed that some people were living longer. They weren't free. They hadn't eradicated HIV, but they had actually extended the life of people with HIV and sometimes prevented it from turning into AIDS. And the goal is still the same in the sense of they want to eradicate it altogether, but there's a gradient. So progress can be made without having an absolute victory, if you will. So no, I think having a high benchmark is important.
And following that, again, because I've had the chance to read your writing, that idea of aspiration as of bringing us all together, to bringing a community to co-create an aspirational goal, gets everybody engaged and willing to try to move towards it. They see themselves as benefiting. But the other thing your work, I think, suggests later in the workbook is that you also have to have practical, testable solutions that you're testing, so that stays your aspiration, but you don't assume that you have to go from where we are today and it's a failure if you're not all the way at the end.
Okay.
That we can make progress. Can you talk?
That's exactly right. And it's sort of interesting, David. So think about equity again. Equity oftentimes in practice focuses on disparities. Targeted universalism actually focuses on disparities too, but it focuses on disparities in relationship to that universal, not just in relationship to each other's. So if we're moving toward that universal, then the disparity is actually decreasing. And we may never get there, right? But that in of itself, and some groups are going to move faster, potentially, because they're further away, so they have more room to run than other groups. That's not a problem. In fact, that should be the case. If every group is moving at the same speed or the same rate to that universal, that's probably problematic. Because the group who's at 0 and the group who's at 90%, they shouldn't be moving at the same rate. The group who's moving at 0 should be moving much faster. So you have all kinds of measurements to say we're moving in the right direction. We still have COVID, but they did something very smart here in the Bay Area, I think, when they were letting communities come off of these different color-coded as to whether or not you were very dangerous, or medium. They drilled down and said, your most vulnerable community have to be doing relatively well. So they disaggregated the data. So you couldn't just say overall, the Bay Area has a low positivity rate and whatever, but there are these hot pockets that are just stuck. It actually pulled those out and say you have to show progress in those. And we recognize that it's harder. We recognize that it's going to take more effort. But we also recognize you're tied to them. You're part of this larger community. And it really, a former student of mine was one of the people who helped put that in place. But I thought it was very smart. It wasn't just we treat everybody the same, and it had disaggregated data, and then it used the data to make policy. That was largely uncontroversial.
So it can work. Jamie, before we have any more questions, I wanted to ask Dr. Powell, my final 3 questions generally are there people that AHRQ should, or organizations and places where AHRQ should be partnering with, not specific communities, but to move forward in this Equity 2.0 space that you think are good partners? Are there resources that you want to call out for people who are inspired and want to learn more? Jamie will collect these and anything else you want to give and send out to others, but I just wanted to give you that chance. And then the final part is, if there's anything I didn't ask or we didn't get a chance to talk to that you now realize you want to say, I want to give you that final word.
Well, thanks for both questions. First, we have a primer on our website, so we invite people to go there. Secondly, we also have, I talked about our clusters of faculty. One of our clusters is a health cluster. So we have 15 faculty that are constantly doing research around various issues. Many of them touch on targeted universalism. And then third, there's a growing number of health providers, including big ones like Kaiser, that's embracing this and they're trying to figure out how to do it right. I mentioned the ACA up in Washington, in California. So I think actually coming together, I was head of population health for Southeast Michigan for about 10 years. We tried to get this into their discourse. We did a special issue I did an article in the American Medical Association Journal, and we're going to do a special issue touching on a lot of these issues. So I think there's a lot out there. And what I would suggest, two things, and we'd be willing to help if it made sense, to look at, quote unquote, a lit review, but also look at a community of practice. So as a research entity, I think it would be great if for you to make this service available to other health providers, help them do it, help them figure out how to do the data. And I think you will find, if done reasonably well, it actually promotes health, equity in a much more healthy way without it being polarizing. So those are some of the things I would recommend. And the last thing I'll say is that I mentioned earlier that I've done a little work with WHO, and they are interested in exploring this. And my staff sometimes feel like we're already stretched, but I also feel like we're doing the work to do the work, right? I mean, we just do different things. We can actually reach the communities in the world in the way that you can. So if you find it useful, just to help people figure out how to adapt it and measure it and move forward.
Great challenge. I think we've got about 2 minutes left. So Jamie, is there anything burning on your side?
Yeah, I had two separate questions from different folks, and this is just to kind of our reality at the end of the day. We are, us and everyone else obviously are limited in resources. And so the question is, what are some effective ways to identify how to target groups of people, geographic places, et cetera? Targeting ultimately seems like it is about resource allocation, which is at least sometimes a political process. And just overall, like if we are limited, how do we go about doing that? What does that look like on the ground?
Right. It's a great question. And then we've dealt with that in a number of places. First of all, at least from my perspective, I think, you may make some different calculations, but I would say even everybody has limited resources. But I would say you actually create weighted ways of actually using their limited resources, but not categorical. So you wouldn't just say, we're just going to focus on the most marginal group. Our experience is if you do it weighted and you make it clear for everyone, even though everyone doesn't get what they need, you actually generate more resources. If you just target a marginal group and leave everyone out, you actually deplete resources. And I have concrete examples of that where, again, people with scarce resources decide to do a weighted approach and to tell a story, the story that we care about everybody. And once everybody knows they're cared about, it becomes more stable, more sustainable, and more resources tend to flow.
And when you say weighted, I just want to make sure I understood it. So we've set our universal community goal of what we think is needed. The group that's a little bit below it gets a little bit of resources to devised not just to them, but to what the structural problem is to get them to their point. And the group that has a bigger gap, we understand their structural issues that are slowing it down, and we invest more to help that group. So everybody's getting some.
Right, exactly.
All towards this goal. Okay.
It's not mechanical, but that's the spirit of what you said is exactly right. Because, like I said,
and living in Washington, the idea that I think I just want to underscore, you brought this out to us, that this is also a communication vehicle. It's a way for making people feel included. And when more people feel included then see themselves in you, they want to continue to join, which may mean they want to put their resources with you so you can do more good work. Whereas if you only pick, if you picked a favorite and said, we're only doing this, it divides the community and may in the end take away the resources.
And there's tons of research to support just what you said.
Which is what you said, but thank you. Glad to hear that. We are at time. Professor Powell, thank you so much for being here with us. I hope we'll have a chance to follow up with you and the Institute. We will definitely follow up after this call to get a few of those things you mentioned so we can send them out to our team. Thank you to everybody at AHRQ for listening today. And for those of you who've joined us later, this is a discussion I hope will continue. Thank you, everyone.
Bye-bye.